All right, it's Dr. Jones with another tip of the day. So you decided you're having that circumferential body lift and you want to know the sequence in which the surgery is performed. Well, this is my sequence, and it really depends on whether you're just having a circumferential body lift or you're including an additional surgery. So typically what I do, I'll mark the patients in the pre-op holding area, probably the most important part of the surgery, the markings, because it kind of serves as a roadmap to actually what takes place. So after that's done, you've seen the anesthetist and or the anesthesiologist and nurses check you in, you got your IV, you go into the OR, you're put to sleep, you're laying on your back, the anesthesiologist puts you to sleep. And so from there, we flip you onto the bed face down. So you're prone, your back is up. You're laying on your face essentially. And so from that, I perform liposuction first, liposuction the entire back. And this also helps debulk the lower back where we're going to be removing some of the loose skin and then make an incision, a lower body incision, and then make one above it, and basically that's the skin and the fat that's going to be removed. The reason I do the liposuction first is it because it allows me to advance the skin or pull the butt up further, and then after that close everything up. I put in the drains, don't sew them in, I just put them in because I like to bring all the drains around out front. And then we flip you over, and then liposuction of the anterior trunk or the abdomen and flanks is done. And then after that, the lower abdominal incision is made. Lift the skin up. This is the abdominoplasty part of the procedure. Do the diastasis repair, and then put the bed in a flex position and take out as much loose skin that is safely possible. Bring the belly button out and close everything up, and bring the drains out through the groin. Sometimes you can add other procedures. If you're having a BBL with this procedure, I reverse the sequence, start on the front and flip you over to the back. And all of these things are important, and a lot goes into planning a procedure. And for me, the most important thing is to try to do as best or safest for the patient. And my thought process behind that sequence is, for the most part, you don't want to have a patient in a prone position or laying on their face for an extended period of time. So for that reason, I try to do that part of the procedure first. And I also find it easier to advance the skin excess to the front as opposed to the back. However, if you're getting fat transfer to your butt, I would do the abdominal part first, just so you're not sitting directly on your butt for a really long time. Yeah, and that's it. But like I said, you can add other procedures. The limiting factor is your underlying health and also the length of time that you'll be in the operating room. Typically, the longer operation is, the more likely you are to have complications.